Everyone. Welcome once again to 2 Minute Telehealth. I'm your host, Theo Harvey. Our goal today is to talk a little bit about the changes that CMS has recently announced in regards to uh, telehealth. They really opened up a lot of different rules when it came to that, and I sent this link into the notes as well, so you'll be able to review this. But there are a lot of changes that we want to cover specific for telehealth that were recently released as early as last week. So let's go into that. One of the things they talked about is really these CMS changes are related to the response to COVID 19 and is really for the current public health emergency. So, to be fair, these are things that may change, but we have to wait and see. One of the things is COVID 19 has truly transformed the telehealth landscape. Because of this emergency, federal government as well as other agencies have seen this as a key strategy to help mitigate the COVID 19 concerns that are happening across our great nation. So, what are some of these specific areas? So, one is they recently expanded the list of eligible telehealth practitioners. So, physical therapists, occupational therapists, and even speech pathologists are also now able to bill for telehealth services. They also are allowing for audio only telehealth service. So, no longer is it required for just the face to face using our video equipment for communication with patients, and these are some of the codes that are reimbursable. Also, for opiate treatment programs, you're now allowed to be able to do two-way interactive audio-video communication, right? And in some cases, can be by phone, depending on the discretion of the provider. And then finally, remote patient monitoring. They're now allowing you to bill remote patient monitoring codes, specifically the code 99454, for at least at a minimum of 2 days for any patient that's suspected of having COVID 19. Uh, um, as many are aware, sometimes the 16-day requirement that was a part of the RPM reimbursement may not necessarily apply to COVID 19 patients. As always, here are the show notes. I'll put information in regards around the blanket waivers and the article that I just discussed. And also, I will send this as well, which is the detailed information on every specific thing that they have talked about for the new waivers. So you'll be ready to go for all the information that's out there. Once again, if you have any questions, I'm Theo Harvey with SensorMed. We're here to help you with all your remote patient monitoring and telehealth needs. Thank you for your time.